Good morning. Today we will be discussing the topic healing of skin wounds. The topic will be discussed under following headings: Introduction, Healing by first intention, Healing by second intention, Factors affecting wound healing, and Complications of wound healing. The process of wound healing or skin wound healing is a combination of regeneration and repair. The regeneration is the proliferation of parenchymal cells, and this usually results in complete restoration of the original tissue. While in repair, there is replacement of injured tissue by fibrous tissue. Depending on the type of the wound healing is accomplished by one of the following ways: healing by first intention or primary union, healing by second intention or secondary union. Healing by first intention or primary union. This type of wound healing occurs in wound with following characteristic: the wound that is clean and uninfected, which is surgically incised, wounds without much loss of cells and tissues, and wounds whose ends can be approximated by surgical sutures. Coming to the sequence of events in primary union. Initially, there will be hemorrhage. That is, immediately after injury, the blood fills the space between the approximated surface of incised wound, which forms a clot. This clot formation has got an advantage. It seals the wound from dehydration and infection from outside. Next is acute inflammatory response. That is, inflammatory cells starts invading the wound site. In the first 24 hours, polymorphs or neutrophils appear from margins of the incision, and these will be replaced by the chronic inflammatory cells or macrophages by day 3. Next step is epithelial changes, which include proliferation of basal cells of the epidermis from both cut margins of the wound, which proliferate and migrate to the incisional space, forming an epithelial spur. This is the process of regeneration. The migrated epithelium separate the underlying dermis from overlying necrotic material and clot, which later forms a scar, which will be cast off. Later, a multilayered epithelium will be formed by day 5. Now, the next step is organization. Organization occurs by the invasion of wound by fibroblast, which occurs by day 3. The fibroblast will start laying down collagen fibrils by day 5. And in 4 weeks, a scar tissue with scanty cellular and vascular elements will be formed at the site of the wound. Now, coming to the healing of suture tracts if the wound is sutured. The suture tract is a separate wound actually, and it is healed by primary intention. When the suture is removed by the day 7, much of the epithelial suture tract is avulsed and dress will be absorbed. These diagrams show how wound healing occurs by primary union. Here there is the clot formation and the invasion of wound site by neutrophils. Later, the epithelial spur which has formed separate the wound from the underlying dermis, and the wound has been invaded by macrophages, fibroblast, and neovascularization has started. Here, the wound is healed with a scar formation, which is composed of mainly collagen fibrils. Now, coming to healing by second intention or secondary union. It is defined as healing of wound by following characteristics. The wound with following characteristics will be healed by secondary union, which includes open wound with large tissue defects, at times infected, wounds with excessive loss of tissues and cells, wound which cannot be approximated by surgical sutures and which is left open. The sequence of events in secondary union. The first two steps are similar to that of primary union. That is, there will be an initial hemorrhage occurring, which fills the wound and forms a clot. And the inflammatory phase or inflammatory response, first the wound will be invaded by acute inflammatory cells or neutrophils. Later, it will be replaced by macrophages. Now coming to the epithelial changes, the epidermal cells or the basal epithelial cells from both margins of the wound will proliferate and migrate to the middle of the wound, forming an epithelial spur, similar to what has happened in the primary union. But since the wound is large, this epithelial spur formation alone cannot fill the wound space or separate the wound from the underlying dermis. So, this is done by granulation tissue. The granulation tissue from base start filling the wound space. This separates the underlying viable tissue from overlying necrotic tissue or scar, which is cast off. Granulation tissue formation plays a major role in wound healing by secondary union. It forms the main bulk of secondary healing. It is composed of fibroblast and neovascularization, that is, new vessels. The granulation tissue appears as deep red granular and fragile tissue. Later, scar tissue is formed by the laying down of collagen, which will become pale and white on maturation due to increase in collagen and decrease in vascularity and cellularity. The fifth step is wound contraction. This is very important feature of secondary wound healing, and this will helps to reduce the size of the wound or healed wound or scar. This occurs by the action of a specialized cells called myofibroblast. Myofibroblast are actually fibroblast which has got contractile properties like that of smooth muscles. And by the action of myofibroblast, the wound will contract and the size of the scar will be reduced compared to the initial size. These diagrams shows how wound healing occurs by secondary intention. Here we can see that the wound is large and a hemorrhage has resulted in the clot formation. Also, there is infiltration of the wound by neutrophils. The next picture we can see that there is granulation tissue formation by fibroblast and neovascularization. And the granulation tissue along with the epithelial spur has separated the underlying dermis from the above scab. Now, here the wound has healed by scar formation and the scar is mainly composed of collagen fibrils. Now, briefing the differences between primary union and secondary union. In primary union, the wound is usually clean, uninfected. The margins can be approximated and sutures can be used. In secondary union, the wound is unclean, may be infected, the margins are irregular, and sutures cannot be used to approximate the wound margins. In primary union, the healing occurs by scanty granulation tissue at the incised gap and along suture tracts. while in secondary union, exuberant granulation tissue will fill the gap. The outcome of primary union is neat linear scar, while secondary union will be a contracted irregular scar formation will be there. The complications are infrequent in primary union. Epidermal inclusion cyst formation can occur in suture tracts if the epidermal lining in the suture tract is not reabsorbed completely. While secondary union, complications are more frequently seen. The main complication is separation due to infection. Complications of wound healing. One of the major complications is infection, which occurs due to poor wound debridement. Next is epidermal cyst formation, which occurs due to persistence of epithelial cells in the wound after healing. Pigmentation of wound can occur. The healed wound may be at times have rust-like color due to staining with hemosidery. Then deficient scar formation can occur due to inadequate formation of granulation tissue. In laparotomy wounds or laparotomy scars, if the wound scar formation is not proper, wound dehiscence can result in incisional hernia. Then hypertrophied scar or keloid formation can occur where the scar formed is excessive and painful. Sometimes excessive wound contraction can result in contractures like Dupuytren's contracture, plantar contractures, etc. Then the last is neoplasia. Sometimes or rarely, scar may be the site of development of carcinoma later. Example, squamous cell carcinoma can occur in Marjolin's ulcer. So this is the picture of keloid scar and an hypertrophy scar. In hypertrophy, scar is confined to the borders of the initial wound, while keloids have tumor-like projections of connective tissue. This is an example, or this is a picture of excessive contracture which has happened in wound healing. Now coming to the factors influencing wound healing. Both local and systemic factors can influence wound healing. Local factors include infections, which delays wound healing, poor blood supply, which also delays wound healing, foreign bodies in the wound, which can cause infection, can delay wound healing, frequent movement, the site of wound can delay wound healing, ionizing radiation can delay granulation tissue formation, then exposure to UV light can facilitate wound healing. Also, the type, size, and location of injury can influence the wound healing. For example, the sites with adequate blood supply, like in scalp, the wound will heal faster. And if the wound has occurred in the joint where there is frequent movement, can delay wound healing. Systemic factors which affect wound healing include age. Rapid healing of wound can occur in younger age, while the wound healing will be delayed in aged. Nutrition. The deficiency of proteins, vitamin A, C, and zinc can delay wound healing. Likewise, systemic infections can delay wound healing. Administration of glucocorticoids can have an anti-inflammatory effect which can delay wound healing. Uncontrolled diabetes delay wound healing since it can promote infection. Also, Hematological abnormalities like defective neutrophil function, neutropenia, bleeding disorders can also delay wound healing. Now, before we wind up, the points to be kept in mind are: healing of skin wounds occur as a result of regeneration and repair. Depending on the type of wound healing occurs by primary union or secondary union. Healing by primary union occurs in clean, surgically incised wound in which healing occurs by regeneration and minimal granulation tissue formation. Healing by secondary union occurs in open infected wounds or large wounds with the tissue loss, in which healing occurs mainly by granulation tissue formation. Thank you.